Visiting today with Billy Kennington. He's an occupational therapist for Star Valley Medical Center. April is an important month for therapy. Tell us what it's all about, Billy.
So April is occupational therapy month. We have a great occupational therapy program here at Star Valley Medical Center, and we like to educate the public on occupational therapy and kind of what we do for the community here.
You're associated with Star Valley Medical Center. You're on the campus. Tell us about your services here at the campus and in association with our hospital.
So we offer a wide variety of services here on campus. Of course, we see patients in the inpatient setting, so people that are in the hospital, as well as we have what's called outpatients, so patients that come here to the clinic. So we have a clinic here in Afton and in Thane, so we provide services for both.
An example of what a patient might come to you with, a problem.
So on an inpatient setting, we see a lot of the total joint patients, patients that have had total knees, total hips. We work along with the physical therapist. The main difference is we look at the functional aspects and help patients to be able to transition home. As many people know, with a total joint surgery or something like that, their everyday occupations or activities are changed, and so we help them to transition home safely and provide whatever they need in that rehabilitation process in the inpatient setting.
At what point does the patient come to you? Right after the surgery? Where do you step in as an occupational therapist?
So in the inpatient setting, we go in right in the room after surgery. As far as outpatient, that means that they're a few weeks or a few days post-surgery. Then they actually can come into our office. We provide services such as hand therapy, post-surgical rehabilitation for hands, as well as just any of those occupations or daily activities that people need help with.
You put them back into their lifestyle that they're accustomed to.
Exactly.
You have someone that assists you. Would you do an introduction for us?
I do. This is Kristen Simpson. Kristen is a certified occupational therapy assistant and has helped me tremendously. The main difference is, as an occupational therapist, I do the evaluations and set up a plan of care, and then Kristen assists me in helping to carry out those plans of care. So she's qualified to help me and to provide those services.
Kristen, tell us about yourself and your career in all of this.
So I graduated about a year and a half ago, and I worked for a year in Gillette. And in Gillette, we had a clinic that I worked a lot on upper extremity issues as well as neurological, such as people who have had experienced a stroke, or also I worked with pediatrics. So I had a wide variety of experience.
What might be an example that both of you would work on? Keeping confidentiality, what might be an example of taking a person from the very beginning to the conclusion?
So usually when a patient, let's just take a hand patient, most everyone knows like a standard carpal tunnel release. A lot of times what happens is a surgeon after the surgery will write a prescription for hand therapy. The first few sessions usually the first session I will complete an evaluation. Depending on what the surgeon wants, will help dictate that plan of care. After my evaluation, we will start that plan of care, and then depending on the schedule, if I need some help, then follow-up visits. Kristen can take that plan of care and help patients move through the rehabilitation process to the point that hopefully they are back to the job of living and not having any more symptoms.
Very good. Kristen, would you add anything to that?
No, I think I covered that.
Very good. Then you work specifically with a physician, the orthopedic surgeon. How do they come to you?
A lot of times it's just a referral, because we do specialize in certain things. They do know, but that is a referral. We do take walk-ins if we do have to have a physician referral though. So we can contact the physician and then also get that referral as needed.
In a summary again, you return quality to life?
Correct.
Very good. Billy Kennington, occupational therapy at Star Valley Medical Center's Therapy Services, along with Kristen Simpson.